guys, welcome back to Medical Coding with Blue. Today's episode is all about what is considered transferable work experience when you are a new medical coder. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, today's episode was inspired by a viewer comment, which I will read here in a minute. But a lot of people ask me this question. Blue, I've been in the healthcare industry before. I've seen diagnosis codes, I've seen procedure codes. Does this count as work experience when I'm trying to get my first job as a medical coder? If I've done this or that, still working with codes, still working with, medical records, does this count? So let's get into the comment and then I'll get into the answer with that. All right, so the viewer says, I've worked for an imaging center for more than 6 years, dealing with patient medical records, CPT and ICD-10. Should have added the CM part on there, but they didn't. ICD-10, CM codes, etc. Does this count as experience to get a job easier? I mean, would I have a higher chance to get my potential employer's attention? I ask because I've been doing this from the Dominican Republic, and I'm really afraid of finishing the course and getting my certification, then struggling like if I've never had any experience related to medical coding. In my country, the more prepared you are, the more you struggle to get a job. Okay, that doesn't make sense. That comment, the last part of that comment doesn't make sense. The more you're prepared, the more you struggle to get a job. Okay, okay. Let's just put that aside. Let's look at a few things here. A lot to unpack. It says that I'm afraid of finishing the course and getting my certification. So they're not even through the course yet, and they haven't even gotten their certification yet. They were already afraid of being able to get a job as a brand new medical coder. But they have this experience of, seeing medical records and seeing, all of these things because they work in a radiology center. Here's the thing. When you have previous work experience and you've worked around diagnosis codes and procedure codes, right? You need to be very specific. Again, the thing I hate the most is when I see people write ICD-10. ICD-10 what? CM or PCS? Which one are you talking about? Because in this industry, it is all about the details, and you have to be sure to make sure that you are very clear about what you have experience in. The problem that comes with this mentality of I'm afraid. If you're afraid, you're always going to be afraid. You may as well stop now. Because if you have that mindset, that's already the poison that's going to stay there. Now, if you want to hear what I have to say, and hopefully you will, you'll put this aside, this fear, this unfounded fear. Because yes, when you're trying something new, when you're getting into a new industry, yes, there's going to be a little bit of a learning curve. There's going to be a little bit of a struggle to get your first job. But it's not impossible. And this is a part that I wish people would hear me on, but so many people don't. They'll come to me with this fear, and then I'll tell them and explain to them, okay, your resume needs to look good. You need to make sure that you're showing what you learned at your previous employer and how getting this medical coding certification enhances the skills that you're bringing over. Now, this person, I don't know what they did at this imaging center, but being able to see all of these things, then you're familiar already with documentation. You're familiar with an electronic medical record. You're familiar with billing and insurance already. Now, they may not be doing that, but they're still familiar with it because you're in that arena and you know. So again, all of this needs to be on the resume and it needs to be put out clear. Now, this comment came off the video, Resume Tips for New Medical Coders. Now, again, if you don't have your certification yet, why are you stressing about something that hasn't even happened yet? Your goal when you are a student is to concentrate on being a student. It is not to think about, oh, what if I can't get a job? Then what are you doing being a student? You're wasting your time then. So if you want to waste your time thinking and overthinking and all of this, and what if I can't, again, then what are you doing? Now, if you got into it because you want to change your life, this is part of it. This new world of finding a job as a medical coder, again, not impossible, but you have to do it the right way. You have to, again, show your resume, on your resume, your training. Because even if you tell me, well, Blue, I have no experience, you don't have to have experience. Do you think I started with experience when I became a medical coder? No, I went to the temp agency and I had a really good resume. I was able to pass an assessment test because they have to be able to assess your skills. And that was how I was able to get in. Now, it took me 2 months of looking and struggling, and my mom was the one who suggested I go to the school and asked the principal for help. And the principal was the one who put me in contact with a temp agency, and that was how I was able to get going. Because after that assignment, I was able to get into another hospital, right, which is another assignment that I got from the temp agency. And I was there for 8 months until I got my permanent coding home, which is where I am now. But do you think in this whole time I sat there and said, what if I don't get a job? No, I didn't. What if I can't? And I didn't do that, because my mentality was, I need to get this because I got my certification. I'm trained and I'm skilled. So I know how I'm competent enough to get into the industry. And I had the credential that a lot of people complain about, which is a CCA. The CCA is a very powerful credential, and I will always advocate for the CCA. The CCA is a certified coding associate, and that is a credential offered with the American Health Information Management Association. You know what's so bad about this credential is that it has entry level in the description of that certification. What people don't seem to get past when they look at that is that person who's taken the CCA has already had the competence of knowing how to code inpatient and outpatient coding, which is a lot more knowledge that you have to have than somebody who's only certified to code for the outpatient setting. And if you don't know what the difference is, look on the website and you'll understand what I'm saying. But trust me when I say that the CCA is not an easy exam. Anybody who passes that exam has a lot of knowledge already out of the gate, and a lot more, again, than somebody who only has knowledge on the outpatient side. Now, there's more opportunity when you have a CCA, because then you can apply for inpatient positions or outpatient positions, as opposed to somebody who is only certified on the outpatient side and who really only can do the outpatient coding unless the facility is willing to train somebody to work on the inpatient side, which it does happen on occasion. But that being said, CCA is just entry level, just because of the description of that credential. But I had it for 13 years, and because I did, I was able to do a lot of things with it. And I put it to bed last year because it was time for me to move on. I need to move up in my career, so that was something I had to leave behind. But I kept it as long as I did because I wanted people to see that this is what a CCA can do. And I did a lot with my CCA. So whether you are sitting for the CCA, the CCS, the CCSP, or even the CPC, everybody has a potential to do a lot with their credential. It depends on the individual. And it starts by having a good mentality and a good mindset. Having a mindset like this, what if I can't, and I haven't even been through the school, I haven't even finished the course yet, I already have my certification, and I'm already worried about making money. I'm already worried about getting a job. That's a wrong place to be, folks. And if that's your mentality, there's nothing that anybody can do for you other than let you go through it on your own. But I hope that you all hear me when I say this. Look at your resume. If your resume does not have all of the things that you were trained on, and please do not copy that one that's floating around the internet that says NCD, LCD, medical billing, Medicare, parts A, B, C, and D. Don't do that. Don't do that. Don't copy from the internet. Do your own resume. What were you trained on in your program? There's a lot of resume writers out there, but I will say for those ones that is their business to write resumes, if you're taking it to a resume writer who is not a medical coder, you're going to get a canned response, right? They're not going to know what the industry is looking for, because maybe they'll do their research on a couple of job listings, and maybe they'll do this, and but it's not a coder talking to another coder. I do resume rewrites. My rate is in the description box below. I'm a coder talking to another coder. My resumes that I've written for people have been successful. So you really have your own choice. But I always tell people to write your own resume before you try to send it out to somebody else, because you will need to know how to write appropriately, especially when we have to send out these queries to providers, or even emails about education to providers. So that is something to keep in mind. A lot of people want to do these shortcuts and they think that it's easy. This field is not easy, guys. And it takes a tough mindset to get in it, Because if you're already showing weakness, like, oh, I'm worried because I can't get a job or nobody wants to look at me, again, what are you presenting to them? Because if I see a 3 and 4 page resume, which a lot of people try to come to me when they're getting their resumes redone with 3 and 4 pages, guys, no. It needs to be 2 pages max. And if you have no work experience, you need to look at all the other things that you've done. If you've done any volunteer work, and in this volunteer work, did you have to protect anybody's information? Again, that's a transferable skill that you have for medical coding, because we have to be able to protect patient information as well, because it requires privacy. Now, there's a lot of other things that you can get started in, and I've done many videos on this very topic, alternative jobs for brand new medical coders. And, you know, it involves ROI, or release of information, medical billing, prior authorizations. There's a lot of different things that you can get into to get you those skills, to get you around the coding so that you can transfer into medical coding. But just because the employer is asking for experience doesn't necessarily mean that you have to not apply. People who don't apply to all the positions that they're qualified for are the ones that are missing out, because a lot of people make the mistake, especially the brand new ones, of applying only for the ones that say entry level. Well, you have that, and you've got thousands of people that are trying to apply for those positions. But if you have these positions that are saying candidate must have 3 to 5 years experience, and you go ahead and apply anyway, every medical coder who has experience is going to be employed unless they want to leave their employer for whatever reason. And so because of this, a lot of people who already have experience are going to be working. That employer may get desperate that they need to hire somebody. So if they see a qualified person who is brand new with no experience, but is willing to be trained and doesn't have any bad habits to break, you know, this may be, you know, something that will be more beneficial for that employer. But you have to put yourself in that position in order to do that. And if you're already convincing yourself, well, you know, I don't have experience. We all went through that. I went through that. And so it's just a matter of taking the rejection that you know you're going to take and keep going. Because every single interview that you go on is making you a better candidate. It is making you better at the industry, because you're going to be learning a little bit from every single person that you're interviewing with. So that is something to keep in mind. But as far as that work experience, that transferable work experience, if you've had exposure to those codes, then you need to make sure that you put that in your resume. What specialty were you in? What kind of procedures was done at that facility, and that kind of thing. Be very specific. And when you're talking about like that you protected patient information, that you verified codes, maybe you were prior authorizations and you were verifying the codes against the documentation, again, something that can be put into your resume. But that's what you have to show, that you have that transferable skill. And I will also say that Practicode is not considered work experience. Practicode is an educational product offered with the American Academy of Professional Coders. They have what is called an apprentice status for their flagship medical coding credential, which is the CPC, or the Certified Professional Coder. Now, for 2 years, this individual who gets this, who gets their CPC, if they've had no work experience before, will have this apprentice status on their name. There's 2 ways that you can get this removed quicker, right? Or there's a couple ways that you can. If you go through their specific program for medical coding, and if you take Practicode along with it, doing both of these actions will get that A removed once you complete Practicode. So you can also, if you didn't go through an AAPC approved program and you just did Practicode, you can get 1 year of your 2-year time commitment removed. So that way you can just be working a year and you can be doing Practicode concurrently, and then you can get your A removed. Do you need to have this A removed quickly? No, you do not. People get hired with the A all the time. This is an additional amount. This is additional monies that has to go out in order to get this Practicode. It's $299 for non-members, $249 for a member. So if you get this, you code 660 real-world redacted records, and you're going through and you're coding these, and it's giving you practice. And they're saying that this is typically what a new medical coder would go through in the first year. So that's why they have this like this, and that is considered 1 year of experience to AAPC. This is not considered 1 year of experience in the working world. If you try to put it on your resume that you have 1 year of work experience and they see that it's Practicode, it's a lie. And they're like already, okay, this person already lied to us, because that is not considered work experience. When it's on your resume, it needs to go under education. That is where I have always put it on all of my clients that have gone through Practicode. I will put it on education. I will not put it as work experience, and I will not put it as an internship either. So that is something that you have to keep in mind when you're writing your resume. You need to be truthful and honest about your experience. Some employers will accept education in lieu of work experience. So that is another thing that you need to be on the lookout for. And a lot of times people are not looking under the appropriate names for medical coders as well, because sometimes they'll just type in medical coder and then they won't find any, or they'll find very few job listings. But when you start looking under medical records tech, when you start looking under revenue cycle tech, or some other weird odd name. There's a lot of weird names that medical coders have. But when you're looking in the job listing, you'll be able to see, okay, this facility calls their medical coders revenue cycle tech. You know, even though I would think that that would be something related to billing, but for some people, for some places it's not. You know, I mean, those are the medical coders. So again, they fall under different names. So you have to look at these job listings. Nothing in medical coding will be handed to you. Everything is a work in progress. Everything we have to work for. We all know this. Do I wish it was different? Do I wish that the way that they handled new people was better? Yes, because I think the industry loses out on a lot of talent every single year. However, on the other hand, I do understand the employers and their hesitation, because a lot of times these programs for medical coding are running people through these programs at a very rapid pace, and these people are ill prepared. Not everybody who gets through a medical coding program is as prepared as they should be. And sometimes people have told me that they feel like they were trained to pass the certification exam and that was it. And they weren't really trained in medical coding. So no employer wants to have to start from scratch. They want somebody that is going to be, ready to go and, can code already. So again, this is why I say that if the coder wants to continually educate themselves, this makes for a better chance to be able to get in, because you're going to be a lot more knowledgeable when you go in and you look at these assessment tests, and you're going to be able to pass these a lot easier than somebody who is just trying to get a job and not do their part as far as study goes. We have to know what doctors know while never having gone to medical school. So that is something that you need to look at. If you've been a biller, if you have been where you select codes, selecting codes is not the same as medical coding. I don't care if you're a nurse and you say, well, I've done the coding, and you're selecting from a like a super bill. That's not the same thing as coding. Coding actually means looking and reading the documentation, comprehending what you're reading, selecting or auditing to make sure that the codes that are selected are correct. That's coding. So, there's a huge difference there. But again, if you're a nurse and you've had that, you have exposure to medical codes, so that needs to go on your resume, that was your duty, that you selected from a pre-listed list of procedure codes and diagnosis codes, and that's what you did. So that's something that you can put down on your resume, so that way they know, okay, that's your level of experience, and now you have your certification. Now let's give you a test to see your skill. So that is something that you guys need to look at and know. Get out of that negative mindset, guys. Stop it with all that negativeness, because the one thing that is hurting is you. And you're wasting your time. The more that you sit there and you spin your wheels and you think about all the negative things when you haven't even gotten through the school yet. The school is a lot already as it is. The course is a lot to get through because you have to do a lot of recall and a lot of repetitiveness so that you can start to absorb it. And a lot of people are looking so far down the line that they're not even paying attention to what they should be paying attention to, which is the school. And then getting to the certification exam, right? And when you get to the certification exam, then you're so busy thinking about what you should have learned in school. Well, I'm not ready yet. I'm not ready yet. And some people go so long with I'm not ready yet that they don't take their exam. They get through the school, they get so freaked out and scared that they don't get to the exam part. Don't do that to yourselves, folks. It's a waste of money. And then what did you spend all that money on school for? So that's something that you guys need to keep in mind. You know, get into a better track of mind when you're getting into these things, because nothing is going to be handed to you, and worrying about stuff that you don't need to be worried about in the interim is not going to do you any favors except for give you undue stress that you don't even need. So that's just my advice anyway. But concentrate on the school if you're in the school. Don't worry about finding a job. That time will come. When you are studying for your exam, worry about studying for the exam, not what you didn't learn in the school. And then when you get your certification, then you can go out there and start getting a really good resume together, and then getting out there and start applying for these jobs. And when you get turned down, then you're going to keep applying anyway. Because if it's so easy to run you off from your goal, from what you want to do, then you didn't want it bad enough. I'm going to wrap it up from there. If this video was helpful for you, like, subscribe, and share, and I will see y'all next time. Bye.